Never eat that sharp. 4 healthy foods, over 60. Dr. Anthony's shocking list. If you're over 60, you've probably spent years being told that eating healthy foods is the key to living longer, feeling better, and keeping diseases away. And that's true in many cases. But what if I told you that some foods often labeled as healthy could actually be harmful for people over 60? These are foods that many seniors eat every day, thinking they're doing the right thing for their bodies. But in certain cases, these foods might quietly be damaging your health. Today, I'm going to share 4 so-called healthy foods that people over 60 might want to avoid, or at least eat with caution. Some of these might shock you. Hi, I'm Dr. Anthony. For over 15 years, I've worked with seniors helping them navigate the often confusing world of nutrition and health advice. One of the biggest challenges I see is that what's healthy for a 30-year-old isn't always healthy for someone over 60. As we age, our bodies change. Our kidneys, liver, and heart become more sensitive. Our metabolism slows down. Certain nutrients can become harder to process, and even healthy foods might cause unexpected problems. That's why it's so important to look beyond marketing labels and understand how specific foods interact with an aging body. Let's start with the first food on my list: spinach. Most people think of spinach as a superfood packed with vitamins, minerals, and antioxidants. And it's true, spinach is full of nutrients like iron, calcium, and vitamin K. But there's a hidden danger, especially for seniors over 60. Spinach is high in oxalates, natural compounds that can bind to calcium in your body and form kidney stones. For younger people with healthy kidneys, this might not be a big problem. But for older adults, especially those with any history of kidney issues, eating large amounts of spinach regularly can increase the risk of developing painful kidney stones. I remember a patient named Linda who was 67. She was trying to eat healthier and started making green smoothies every morning with lots of raw spinach. Within a few months, she began having severe back pain and was diagnosed with kidney stones. She was shocked because she thought she was eating one of the healthiest foods possible. After discussing it, we adjusted her diet to include other greens, lower in oxalates, like romaine, lettuce, or kale, in moderation, and she's had no new kidney stones since. Spinach is not bad for everyone, but if you're over 60 and prone to kidney stones, it's something to eat in moderation rather than every day. The second food on my list is grapefruit. Grapefruit is often praised for being low in calories and high in vitamin C, which can boost your immune system. But here's what many people over 60 don't realize: grapefruit interacts dangerously with many common medications. Grapefruit contains compounds called furanocoumarins that interfere with enzymes in your liver responsible for breaking down certain drugs. As a result, the levels of these medications in your bloodstream can become dangerously high, increasing the risk of side effects. I've had several patients run into problems because of grapefruit. One of my patients, Tom, age 72, was taking medication for high blood pressure and cholesterol. He loved starting his day with a glass of fresh grapefruit juice. Over time, he began feeling dizzy and weak. Tests showed his medication levels were far too high because the grapefruit juice was preventing his body from clearing the drugs properly. Once we removed grapefruit from his diet and adjusted his medications, he felt much better. Grapefruit can interfere with dozens of medications, including statins for cholesterol, certain blood pressure medications, and even drugs used after heart surgery. That's why, if you're over 60 and taking any prescription medications, always check with your doctor or pharmacist before eating grapefruit or drinking grapefruit juice. The third food on my list might surprise you even more: Bran cereals and high-fiber grain products. We've all been told that fiber is good for digestion, helps lower cholesterol, and keeps us feeling full. And that's true. But there's a hidden problem for seniors: Bran cereals are extremely high in insoluble fiber, which can be harsh on an aging digestive system. Seniors often have slower digestion, less stomach acid, and are more prone to constipation, bloating, and even nutrient deficiencies. One of my patients, George, who was 69, started eating a large bowl of Bran cereal every morning because he wanted to lower his cholesterol. Within a few weeks, he began experiencing severe bloating, stomach cramps, and diarrhea. He couldn't figure out what was wrong until we looked at his diet. By cutting back on the high-fiber cereals and switching to gentler fiber sources like oatmeal and fruits, George's symptoms resolved completely. Too much insoluble fiber can also interfere with the absorption of minerals like calcium, iron, and zinc, which are especially important for seniors to maintain bone health and prevent anemia. So while fiber is still important after 60, it's crucial not to overload your system, especially with high-fiber cereals that your body may not tolerate well anymore. The fourth food on my list is soy products. Soy has been marketed for years as a healthy alternative to animal protein, and it does have benefits. It's low in saturated fat and contains plant-based compounds called phytoestrogens, which can mimic estrogen in the body. For some people, this might be helpful, but for others, it can cause issues. In seniors particularly, those with a history of hormone-sensitive cancers like breast or prostate cancer. Consuming large amounts of soy can potentially stimulate hormone activity. I had a patient named Susan who was 60 and recently diagnosed with early-stage breast cancer. She switched to a diet high in soy, thinking it was healthier and would help her fight cancer. But her oncologist advised her to limit soy because of its estrogen-like effects, which could possibly fuel hormone-sensitive tumors. It's true that research is mixed, and moderate amounts of soy might be safe for many people. But for seniors, especially those with certain health histories, it's important to discuss soy intake with your doctor. These are just 4 examples of foods that many people think are healthy, but can become problematic after 60. It doesn't mean you have to avoid them entirely, but it's crucial to understand how your body changes as you age, and how even healthy foods can sometimes do more harm than good. One of the most important things to understand as you get older is that your body becomes more sensitive to certain nutrients, chemicals, and compounds found in foods. This doesn't mean you have to stop eating everything you love, but it does mean you need to pay closer attention to how certain foods affect you. It's also crucial to remember that what might be a healthy food choice for one person could be problematic for another, especially after the age of 60. For example, let's talk more about spinach. People often assume that because it's labeled a superfood, there's no limit to how much you should eat. But as I mentioned earlier, spinach is high in oxalates. These compounds can bind with calcium and form sharp crystals that settle in your kidneys, leading to kidney stones. But that's not the only problem. High oxalate intake over time can also contribute to joint pain for some people, particularly those who are prone to conditions like gout or arthritis. I had a patient named Robert who was 70 years old. He started eating large salads every day with lots of raw spinach because he wanted to lower his cholesterol naturally. But after a few months, he developed painful swelling in his joints and passed a kidney stone that landed him in the emergency room. He was shocked because he thought he was doing the right thing for his health. We modified his diet, substituting other greens like arugula and romaine lettuce, and his symptoms improved. This doesn't mean spinach is poison, but if you're over 60 and have a history of kidney stones or joint issues, eating it in large amounts might not be the best choice. Another food we touched on earlier is grapefruit. It's one of those fruits that seems harmless, even beneficial, but in reality, it can be dangerous for seniors who are on multiple medications. Grapefruit can cause the levels of certain drugs to rise in your bloodstream, making them toxic. Even small amounts of grapefruit can block the enzymes in your liver that help break down medications. This can lead to side effects like dizziness, muscle pain, dangerously low blood pressure, or irregular heart rhythms. I remember a patient, Carol, who was 74 and taking medication for her cholesterol. She enjoyed half a grapefruit with breakfast most mornings. After several months, she started experiencing severe muscle pain and weakness. Her blood work showed her medication levels were far too high, causing muscle breakdown, a condition known as rhabdomyolysis, which can damage your kidneys. When we removed grapefruit from her diet and adjusted her medication, the symptoms disappeared. Grapefruit might be healthy for some people, but if you're over 60 and taking prescription drugs, you must talk to your doctor or pharmacist before eating it regularly. Now let's talk more about high-fiber cereals and Bran products. Many people believe that more fiber is always better, especially as they age. It's true that fiber helps keep your digestive system moving and can lower cholesterol. But too much fiber, especially insoluble fiber like wheat bran, can cause digestive distress in seniors. As we get older, our intestines slow down. Stomach acid production often decreases, and we're more prone to issues like constipation, bloating, and discomfort. I had a patient named Harold, age 68, who switched to a high-fiber Bran cereal because he wanted to lower his cholesterol. Within weeks, he developed severe abdominal cramping, bloating, and diarrhea. He was miserable and losing weight. When we analyzed his diet, it turned out he was getting nearly double the recommended daily fiber intake. Once he reduced his fiber to a moderate level and switched to gentler sources like oats and fruit, his symptoms resolved. Another problem with very high fiber intake in seniors is that it can interfere with the absorption of key minerals like calcium, iron, magnesium, and zinc. These minerals are crucial for bone health, immune function, and energy levels. Many older adults are already at risk of deficiencies, so it's important not to go overboard with high-fiber cereals just because the box says they're heart-healthy. Soy products are another food that deserves a closer look for people over 60. Soy has become a popular alternative to meat and dairy because it's low in saturated fat and contains plant-based protein. However, soy also contains phytoestrogens, compounds that mimic the hormone estrogen in your body. For some people, especially women who have had hormone-sensitive cancers like breast cancer, or men with prostate issues, certain amounts of soy could potentially increase hormonal activity. I had a patient named Barbara who was 66 and had a history of breast cancer. She decided to switch entirely to soy milk, soy-based meat alternatives, and soy protein powders because she believed it would help her stay healthy. Her oncologist grew concerned because excessive soy intake could theoretically stimulate estrogen receptors in certain cancers. Although research is still ongoing and moderate soy intake may be safe, we recommended Barbara scale back her soy consumption and diversify her protein sources. For most people, eating soy occasionally is unlikely to cause harm. But for seniors with certain medical histories, especially hormone-related conditions, it's essential to discuss soy intake with a doctor. Moderation is key, and it's always safer to vary your diet rather than relying heavily on any single food, even one that's considered healthy. The biggest lesson here is that healthy eating after 60 isn't just about following general rules, like eating fruits, vegetables, and whole grains. It's about knowing how specific foods interact with your body, your medications, and your unique medical history. What's healthy for one person might be risky for another, especially as we age and our organs become more sensitive. Many seniors assume that if something is labeled low-fat, high-fiber, or plant-based, it must be safe. But our bodies change after 60. our metabolism slows down. Our liver and kidneys process substances differently. Hormonal balances shift. All these changes mean we have to be smarter and more cautious with our choices, even when those choices appear healthy. This doesn't mean you have to fear food or give up everything you enjoy, but it does mean you should pay close attention to how your body responds to different foods and talk openly with your doctor about your diet, especially if you're managing chronic health conditions or taking medications. In the next part, I'll share practical tips on how to adjust your diet safely after 60, along with another real-life story that shows how avoiding certain healthy foods helped one of my patients feel better and stay healthier. Let me share with you the story of another patient named Michael, who was 60 years old. Michael had always believed he was eating a healthy diet. Every morning he drank a smoothie packed with raw spinach, added a glass of grapefruit juice, and ate a bowl of high-fiber Bran cereal. He also started drinking soy milk to cut back on dairy. For months he felt like he was doing everything right, but then he began experiencing sharp pains in his lower back, felt constantly bloated, and noticed bruises appearing on his arms, even though he couldn't remember bumping into anything. He also began feeling exhausted losing weight and having trouble concentrating. Michael came to see me because he was worried that he might have cancer. When we looked closer at his diet and ran some tests, we discovered that the oxalates in his daily spinach smoothies were contributing to kidney stone formation. His grapefruit juice was interacting with his blood pressure, making his drug levels dangerously high. The high-fiber cereal was irritating his digestive system, causing bloating and nutrient deficiencies, and the large amount of soy milk he was drinking was unnecessary and potentially affecting his hormone balance. After we carefully reviewed his diet, made adjustments, and monitored his lab work, Michael started feeling better within weeks. His kidney function improved, his digestion normalized, and his bruising disappeared. He told me, "Dr. Anthony, I thought I was being so healthy, but I didn't realize these so-called healthy foods could cause me so many problems." Michael's story is a perfect example of why seniors over 60 need to look beyond labels and marketing hype and understand how foods affect their unique health situations. So what can you do right now to protect yourself if you're over 60 and want to eat healthily without unknowingly harming your body? The first step is moderation. Even healthy foods can cause issues when consumed in excess. For example, enjoying spinach in salads a couple of times a week is usually fine for most people, but drinking large green smoothies loaded with raw spinach every single day might not be the best idea if you're prone to kidney stones. Second, pay close attention to how your body reacts to different foods. If you start a new health habit, like drinking grapefruit juice or eating a high-fiber cereal, and suddenly feel unwell, bloated, fatigued, or notice other strange symptoms, don't ignore it. Your body might be trying to tell you something. Third, keep an updated list of all medications you're taking and check for food interactions. Grapefruit is a perfect example of how something seemingly harmless can interfere with important medications. Always talk to your doctor or pharmacist before making major changes to your diet, especially if you're taking prescription drugs for blood pressure, cholesterol, heart rhythm issues, or other chronic conditions. Fourth, if you're considering adding more soy to your diet, especially through supplements or large quantities of soy milk. Talk to your doctor if you have a history of hormone-sensitive conditions like breast or prostate cancer. Moderate amounts of soy are generally safe for many people, but it's always better to be cautious, especially as research continues to evolve. Fifth, remember that high-fiber foods are good for you, but should be introduced slowly and in moderate amounts if you're over 60. Your digestive system might not handle sudden increases in fiber the same way it did when you were younger. Instead of loading up on Bran cereal, try adding fiber gradually through fruits, vegetables, and whole grains, and be sure to drink enough water to help your digestion. 6th schedule, regular checkups with your doctor. Many of the silent issues caused by so-called healthy foods might not show obvious symptoms until they've already caused significant problems. Routine blood work, kidney function tests, and liver function tests can catch potential issues early before they become dangerous. 7th, don't be afraid to ask questions. If you read about a new superfood online, or hear about a trendy diet, check with your doctor first. Not every health trend is suitable for seniors, especially when it comes to how food interacts with medications, your organs, and your overall health status. I've seen so many patients like Michael who were trying to do everything right, but ended up harming themselves because they didn't realize how certain foods could affect their health after 60. The truth is, there's no such thing as a universally perfect diet. Health after 60 is about balance, moderation, and personalizing your choices to fit your unique body and medical history. So let's quickly recap the 4 foods we talked about today that people over 60 might need to be careful with. 1. Spinach, which is high in oxalates, that can lead to kidney stones or joint issues in some people. 2. Grapefruit, which can dangerously interact with many common medications. 3. High-fiber Bran cereals, which can cause digestive upset and block nutrient absorption if consumed excessively. And 4. Soy products, which may not be suitable in large amounts for people with hormone-sensitive conditions. These foods aren't necessarily bad for everyone, but if you're over 60, you owe it to yourself to look deeper and ask whether what's labeled as healthy is truly right for your body. You don't have to eliminate these foods entirely, but it's important to eat them wisely. Pay attention to how they make you feel, and check with your doctor about any concerns. If you found this video helpful, please subscribe to this channel for weekly doctor-approved health tips designed especially for people over 60. Give this video a like so more people can discover these important insights and protect themselves too. And leave me a comment below. Have you ever had an experience where a food you thought was healthy ended up causing problems? Or is there another topic you'd like me to cover in a future video? I read every comment, and your stories help me create videos that truly help people. Thank you so much for spending your time with me today. Take care of your health, and take care of yourself. I'm Dr. Anthony, and I'll see you in the next video.